Okay, so the fourth type of lipids that we're going to discuss are the messenger lipids. And there are two chemical messengers. They are the steroid hormones and icosanoids. Steroid hormones are cholesterol derivative. When we say hormones, these are biochemical substances produced by a ductless gland that has a messenger function, meaning they could communicate between, or they are means of communication between various tissues. Okay, for the first type of steroid hormone, we have sex hormones, and they controls the reproduction and secondary sex characteristics. We have natural hormones, namely estrogen, androgen, and progestin. Okay, so for estrogen, these are responsible, or these are rather female sex hormones, and they are synthesized in the ovaries and adrenal cortex. They are the one responsible for the development of the secondary sex characteristics at the onset of puberty, and also, aside from the secondary sex characteristics, they also regulate the menstrual cycle. Okay. Aside from that, they also stimulate the development of the mammary glands during pregnancy. So that's the message. The message that an estrogen will deliver is for the body to develop secondary characteristics, the regulation of menstrual cycle, the development of the mammary gland during pregnancy, and it also induces estrus or heat in animals. The primary estrogen is known as the estradiol. The second sex hormone is the androgen, or the male sex hormone. They are now synthesized in the testes and adrenal cortex. They promote the male secondary sex characteristics. They also promote muscle growth, and testosterone is the primary androgen. The third is the progestin, sorry. These are pregnancy hormones. They are synthesized in the ovaries and the placenta. They prepare the lining of the uterus for the implantation of the fertilized ovum, and they suppress ovulation. And the primary progestin is progesterone. So we have three sex hormones, natural sex hormones. Now, for the synthetic steroids, we have oral contraceptives and anabolic steroid. We all know that oral contraceptives suppress the ovulation as a method of birth control. So this contains the mixture of the synthetic estrogen and synthetic progestin. The estrogen regulates the menstrual cycle. That's why those who take oral contraceptive will have their regular menstruation. And the progestin content could suppress the ovulation. Thus, they are creating the false state of pregnancy. Okay. And then we also have anabolic steroid. These are being used by the athletes to build up muscle strength and enhance endurance. However, the use of anabolic steroids are prohibited because it is considered as a form of cheating, and it gives a side effects such as heart attack, liver problems, testicular shrinkages, decreased sperm production, breast development among men, and causes masculinization in women. So, no to anabolic steroids for athletes. Okay. Now, second is the adrenocorticoid hormones. Okay, so second steroid hormone. Kanina yung first natin ay the sex hormone. The next steroid hormone is the adrenocorticoid hormones. This regulates the numerous biochemical processes in the body. So we have two natural hormones, or natural adrenocorticoid hormones, the mineralocorticoids and the glucocorticoids. When we say mineralocorticoids, they control the balance of sodium and potassium ions in the body. And the major mineral corticoid is the aldosterone. Okay, then for glucocorticoid from the glucose. So this controls the glucose metabolism and they counteract inflammation, and cortisol is the major glucocorticoid. Okay. For the synthetic, we have cortisone and prednisolone. So these are prescription drugs used to control the inflammatory diseases such as rheumatoid arthritis. Okay, so we have the second, icosanoids. These are oxygenated fatty acid with 20 carbon atom, and they could function as the membrane lipid. Unlike the true hormone, icosanoids are not transported in the bloodstream. Okay? So yung mga hormones kanina na produce sila in the ductless glands and they could transfer the message via bloodstream. Pero pag kay icosanoid, kung saan siya na-synthesize, dun lang yung site of action niya. Okay? So, they exert their effects in the tissues where they are synthesized. And these are prostaglandins, thromboxane, and leukotriene. For prostaglandin, the message is to raise the body temperature, increase the secretion of the protective mucus layer in the stomach, and also intensify the pain and inflammation process. So kapag may sakit ka, prostaglandin, i-raise niya yung body temperature mo, intensify niya yung heat mo, yung pain mo, just to give the message that there's an inflammation in your body. Okay? For thromboxane, they are produced by the blood platelets and they promote formation of blood clots naman. Okay, so the message is to form blood clots. For leukotriene are found in the leukocytes or the white blood cells. Now, the message is to elevate the inflammatory and hypersensitivity allergies or hypersensitivity or allergy responses. So, leukotriene, ang message naman niya is the hypersensitivity or allergy responses. Okay, so when we have injuries or damage to the bodily tissues, there is an inflammation. Now, to counteract this inflammation because of the prostaglandin molecules, we tend to take medicines like as aspirin, ibuprofen, naproxen. Okay, so these are over-the-counter anti-inflammatory drugs, and diclofenac, which are prescription medicine. Okay, so this medicine counteracts the effect of prostaglandin. Okay, so because these drugs are anti-inflammatory, they are antipyretic, meaning they could reduce the fever or fever reducer. They are analgesic, meaning they could relieve the pain. Okay, however, these drugs, if they're going to prevent the prostaglandin synthesis, which actually raise the body temperature and promote inflammation, we are inhibiting the enzyme cyclooxygenase. Okay, cyclooxygenase has two types: the cyclooxygenase 1 or COX-1, which is responsible for the protective mucous coating of the stomach, and the COX-2, which is responsible for the inflammation. So remember that prostaglandin is the one responsible for raising the body temperature and for the production of protective mucus. Now, if we're going to take medicines like aspirin or any anti-inflammatory drug, the one we are suppressing is the enzyme cyclooxygenase, which is responsible for creating prostaglandin. Now, what happens is we are limiting or we are suppressing the COX-1 and COX-2. That's why most patients taking anti-inflammatory drugs are insusceptible to stomach irritation and ulcer because COX-1 has been inhibited as well. Okay, so, pero nowadays, meron ng mga anti-inflammatory drugs that are COX-1, COX-2 lang. COX-2 specific lang siya. Okay, so pag sinabing COX-2 specific lang, yung cyclooxygenase 2 lang ang sinosuppress niya. Tapos, which is responsible for the inflammation. Yung, yung cyclooxygenase 1 naman, patuloy pa rin. Kaya na-prevent yung stomach irritation and ulcer kasi meron pa rin yung pag-produce ng protective coating for the stomach lining. Okay? Yung mga COX-2 inhibitor ang tawag sa kanila.